Hello, YouTube. This is Gina Lau with Otsuka Pharmaceutical Development and Commercialization. Recently, Psyche hosted a webinar entitled Long-Acting Injectable Antipsychotics and the Evolving Healthcare Landscape Post-COVID-19 Pandemic for Patients with Schizophrenia and Bipolar I Disorder. During the discussion, our speakers discussed how the evolving COVID-19 pandemic has affected care in patients with serious mental illness, as well as accessing medications. As always, the presentation was sponsored by Otsuka Pharmaceutical Development and Commercialization and Lundbeck, committed supporters of the mental health treatment community. Speakers are paid consultants to Otsuka, and I'm an employee of Otsuka. Let's look at a few clips from the webinar.
Yeah, thank you for that. And it seems that given that they are at such high risk for contracting and possibly having a poor outcome from contracting COVID-19, this obviously puts a strain on how they're able to receive treatments. So, what we've heard time and time again is that there's already challenges for people with mental illness to receiving treatment. How, I guess, talk to us a little bit about how this additional burden has placed on actual receiving care.
Yeah, so what we've seen, not only in mental health, but also in physical health, is that the approach to get care has gone down because people were afraid to leave the house, didn't want to be in hospitals that might be viral infection loci. And I think people with mental illness also got more scared of the impact of the pandemic and of other people. Stress also breeds stress. So one natural reaction is to just stay home and try to shield yourself. But that obviously is a problem because if you don't go to receive ambulatory care, you might not be prescribed medications. Now, the field has responded to that with another element, and that's telemedicine. And it's interesting, this might actually be something that should stay in a hybrid way for certain patients because we've seen less no-shows. We have actually patients who otherwise had a hard time keeping appointments, getting organized to leave the house. They might have had social anxiety, not wanting to be confronted with a heightened sense of ill being or also of paranoid ideas when they're outside. It's easier to actually reach them now in the home, when they have a home, and when they have also a place that's secure, that can't be overheard. So those patients who have a computer or a smartphone, who have a secure space and a private space, actually, we've been able to reach them better in a way. That's a good thing for certain patients, and I think that should stay in the future, but others need the personal contact. I mean, we need personal contact, and since many patients with schizophrenia and bipolar disorder are isolated and don't have the human component, might actually want to go and see the injection nurse or the psychologist or the doctor to have something to do, to give structure to the week or the month and have something to say and have an interaction. That is taken out. And that might actually increase negative symptoms, maybe depression, despair, and isolation that patients with mental illness already have. So it's a little bit of a double-edged sword and a mixed bag. And in terms of what we are learning from the pandemic, I think is that the hybrid and adaptive model is what we need, whether it's for virtual conferences, where some people say, I would never want to be in a room with others again. It doesn't help me to have to leave my job and my kids. I just want to go in virtually when I want. And others say, stop the Zoom. I'm getting zoomed out here. I need human contacts. And that's the same for patients. So having this opportunity to do both, I think, can be helpful. But the problem is continuity of care also involves getting medication. And when patients are not going out to go to the pharmacy, well, what we've done is mailing them some medication. That might work for certain medications where you don't have to be seen, that are not scheduled. And it works also for medications that don't have to be given by a healthcare provider. So medications where a healthcare provider needs to give the treatment, that's been a challenge. And long-acting injectables are among those where we think they actually help maintain care the better than even oral treatment. And even when patients are in quarantine or isolation and can't even leave the house to get care, the blood level would still be there. But it's only there if they are sometimes able to go to a clinic and get the injection. So here again, the clinics had to adjust. And that meant maybe doing a drive-through clinic where patients just drive by if they have a car, call the clinic, and someone who's in robes and protective gear walks out, checks the identity card, and then rolling down the window gives the injection just like this. And there's no touch point between the patient and the clinic. That's one possibility. Other clinics have really adjusted well by having a lot of education to patients and families, having sanitary and protective gear sitting there, calling the patients and families before the actual appointment, making sure that they don't have symptoms, measuring them at entry to the clinic. They spaced out both the physical space, but also the times when people could arrive, and were able to actually keep the same number of long-acting injectables or even increasing them, because during the pandemic, it might actually be a good thing to have more LAI treatment than less LAI treatment, because there is this protective factor even when there is a gap in medication taking or access to medications that otherwise would lead after a week or so to zero blood levels. It gives, I think, everybody more safety and also confidence, including family members that might not be able to get to patients to supervise medication intake because they're in separate cohorts and not wanting to get infected. So here, this extra checking element that can be helpful, reminding, might be taken out, which is a risk factor for more non-adherence and relapse.
Thank you for watching our YouTube teaser. If you'd like to watch the entire presentation on psychu.org, please click the link in the description. You can take a look at our upcoming webinars while you're at there as well. Be sure to follow us on Twitter, LinkedIn, Facebook, and Instagram, and have a great day.